session today. It is a great saying, when the going gets tough, the tough gets going. Okay, so we would be having 6 to 8 regular sessions on YouTube where we would discuss about the aims, PGI, Jipmer and the tips to solve the various exams. So in the Unacademy special classes, this week we would be having nystagmus, squint test and discussion, neuro-ophthalmology test and discussion, and Unacademy live courses with medical marathon and batch course on important chapters in ophthalmology. You would use a code Dr. Vineet YT to get 10% off in all the NEET Plus courses. Not wasting the time, we are going straight to our topic. So the first question for you is, mark the wrong statement regarding the corneal anatomy. Transparent, avascular, contribute 2/3 of the refractive power of the eye, refractive index 1.40. Try to answer. Can you all hear me now? So very good, Dr. A1. It is D. So remember, the refractive error, or sorry, the refractive index of cornea is 1.37. Okay, so remember this mnemonic, 8304. So the refractive index of cornea is 1.37 to 1.38. Then the aqueous humor, it is 1.33. The lens, it is 1.40, and for the vitreous humor it is 1.34. So if they ask the maximum refractive index is of the lens, and in the lens the maximum refractive error is, the maximum refractive index is of the center of the lens. Okay, so remember, cornea is a transparent and avascular structure. Why it is made? It is made so that light can enter into the eye and go to the main layer, that is retina. So now we would discuss about the various layers of cornea. So you have to arrange the layers of cornea from anterior to posterior. These are your 4 options. Try to answer. So can you see the question? So very good, Dr. Ashish. The answer here is A. So the first layer of the cornea is the epithelium. Beneath the epithelium we have the acellular layer, that is the Bowman's membrane. After the Bowman's membrane there is the thickest layer of cornea, that is the stroma, and now a new layer described by Dr. Harminder as Dua is called Dua's layer. This Dua's layer is beneath the stroma. That means it is between the stroma and the Descemet's membrane. So the next layer is a very strong layer, that is the Descemet membrane, and the last but not the least is the layer that is endothelium. Is it okay, everyone? Should we move to the next question? Okay, so the next question for you is, oxygen requirement of cornea is mainly taken care by which layer of cornea? Epithelium, endothelium, Descemet membrane or stroma? So my question is, which layer causes the eye to uptake the oxygen? So very good, Dr. Nisha. Dr. Rahul, the answer is epithelium. Okay, the first layer of the cornea. Another question that was asked in Jipmer few years back was what the epithelium is made up of. So epithelium is not single layered. Remember, the single layered is your endothelium. Epithelium is 3 layered, made up of stratified squamous non-keratinized epithelium. It harbors the tear film and very important, does the oxygen uptake from the environment. So that's why when you use a contact lens over your cornea, this can basically cause less oxygen to go inside, would cause accumulation of a very important substance, that is the lactate inside, which can cause a corneal edema. A very good point about epithelium is that even if it is shred, okay, even if there is an epithelial defect, it can regenerate within 48 to 72 hours. So nothing to worry, just patch the eye and it would regenerate in 48 to 72 hours. Is it okay, everyone? Okay, so the next question for you is, calcium deposition in Bowman's membrane takes place in which layer of cornea? Okay, so we are asking about a disease where there is a calcium hydroxyapatite deposition in Bowman's membrane. Can you name the disease? So my question here is, can you name the disease? So my question here is, Bowman's membrane, you have the calcium deposition. Can you name the disease? Yes, Rahul, yes, very good. It is the band shaped keratopathy. Okay, so here it is the Bowman's membrane, you have calcium deposition seen in band shaped keratopathy. Remember, Dr. Rahul, in Wilson's disease there is a corneal, the deposition of copper in the cornea, and that takes place in Desmond's membrane. Okay, so Desmond membrane has copper deposition in Wilson's disease. In band shaped keratopathy you have calcium deposition. Is it clear, Dr. Rahul? Okay, very good. So remember few important points regarding Bowman's membrane. An acellular membrane made up of condensed collagen fibrils, 10 to 12 micrometer of thickness. Basically what makes the Bowman's membrane? It is the superficial part of stroma. Very important is, unlike your epithelium, it is unable to regenerate. Okay, it is unable to regenerate and heals by scarring. Okay, and it is site for deposition of calcium. Remember a mnemonic, B goes with B. So Bowman's membrane is having deposition of calcium in the cases of band shaped keratopathy. Okay, okay, so the next question is, thickest layer of cornea, epithelium, Desmond membrane, Bowman's membrane or stroma? So Rishita, KF ring is there in the Wilson's disease having copper deposition in the Desmond membrane. Okay, so my question is, thickest layer of cornea. Very good, Dr. Sneha. The answer here is stroma. So remember, the stroma contributes 90% of the corneal thickness. So usually in Indian eyes, the corneal thickness is around 520 to 540 micrometer. Out of this, 450 to 500 micrometer is contributed by stroma only. One question asked few years back in Jipmer is that type 1 collagen is the most abundant type of collagen in the stroma. So I would give you a list of which type of collagen is present in which layer of the eye and how much abundant it is. Remember, it transmits 90% of the incoming light. So the nature of stroma is very important for the transparency of the cornea. It derives its oxygen from the precorneal tear film, but other nutrients it derives from the aqueous humor. Okay, and it is acellular and there is a lamellar orientation of collagen fibers. What you mean by lamellar orientation? This is lamellar orientation. Is it okay, Dr. Rahul? What is lamellar orientation? So this basically causes the cornea to be transparent. Okay, the next question is, strongest layer of cornea is epithelium, endothelium, Desmond membrane or stroma? So the answer here is very good, Dr. A1. It is the Descemet's membrane. So remember, the Descemet membrane acts as a basement membrane for the endothelial cells. It is the most important layer, or you can say the toughest layer, that provides the protection from perforation. So whenever all the layers are destroyed, the descemetocele goes in the front and basically helps to protect the eye to the maximum. Remember, like epithelium, this also can regenerate, but whenever it regenerates, it does not regenerate within 48 to 72 hours. So the maximum regeneration capacity is of epithelium and not of the Descemet membrane. As I told you, it is the site for deposition of copper. Okay, so remember a mnemonic: KFC delivery. Okay, so in KF ring we have copper deposition in Descemet membrane. Is it clear? Okay, now there is a new layer which is described beneath the stroma, that means under the stroma above the Descemet membrane. It is said to be a very tough layer and mostly consists of collagen type 1. The thickness is very thin, around 10 micrometer. This layer is called Dua's layer. Okay, so the next question for you is not true regarding endothelium. 3 layers of cells, powerhouse of the kitchen, responsible for maintaining dehydrated state of cornea. Normal specular count in an adult is 2500 to 3500 per millimeter cube. So I answered this question when I started the session. So very good, the answer here is A. So remember, endothelium is not having 3 cells, it is a single layer of cells, also called the powerhouse of the kitchen, responsible for maintaining the dehydrated state of cornea by the pumps. Remember, any intraocular surgery or uveitis or aging would decrease the specular count, which is normally is 2500 to 3500 per millimeter cube. So the endothelial count is maximum in the when the baby is born, and with age it starts decreasing. It is made up of hexagonal regular cells. Okay, so the specular microscope is basically used to measure the amount of cells, number of cells, and the shape of the cells. Okay, so now we would go to the retinal layers and histology. So remember a term for eye, for retina there are 10 layers. The 9 layers all inclusive are coming under the neurosensory retina part, and the layer that is left is the retinal pigment epithelium. Okay, so if you can see, this is the OCT picture, this is vitreous. These 9 layers of the retina, okay, are called neurosensory retina, and this layer is retinal pigment epithelium. Okay, so the innermost layer near the choroid, so this is choroid, that is a retinal pigment epithelium. Okay, and the other layers are the neurosensory retina. So Dr. Rahul, the OCT is called optical coherence tomography. It shows the various layers of the retina. So it is like a biopsy of the retina, where all the retinal layers, their thickness can be seen. Okay, so my question for you is, which of the following is the layer that touches the vitreous? Retinal pigment epithelium, outer nuclear layer. Okay, the last option is inner limiting membrane. Okay, so your options are retinal pigment epithelium, outer nuclear layer, inner plexiform layer, or inner limiting membrane. So very good, Dr. Surendra. The answer is inner limiting membrane. Okay, So I told you that the 9 layers are called neurosensory retina. Out of this, the topmost layer is the inner limiting membrane. Okay, and this is the retinal pigment epithelium. Now I would tell you the various layers of the retina. Okay, so the first layer, which is in touch with the vitreous, is inner limiting membrane, followed by the nerve fiber layer. Then comes the ganglion cell layer. Remember, the ganglion cell layer is basically damaged in glaucoma. After this comes the inner plexiform layer, followed by inner nuclear layer. So if you can see here, okay, this is the inner nuclear layer, the pycnotic nuclei. Okay, this is always showing the nuclear layer. So the one which is near the vitreous is the inner nuclear layer, and which is near the choroid is the outer nuclear layer. So you can just see how to identify various layers in the retinal histology. Then comes the outer plexiform layer. Okay, then the outer nuclear layer, external limiting membrane, photoreceptor layer having rods and cones, and the most important, retinal pigment epithelium. There can be question asked on the retinal pigment epithelium that what are the roles of the retinal pigment epithelium. So it regulates the visual cycle, okay, transports the nutrients, important for the phagocytosis, and the immunological role of the retina is there because of the retinal pigment epithelium. So let's move to the next question. Which of the following is not true about the cones? Less in number than rods, not present at fovea, responsible for color vision, contain pigment iodopsin. So try to answer. My question is not true about cones. So cones is a layer which is there in the photoreceptors, rods and the cones. So very good, Dr. Nikita. The answer here is B. So remember, the fovea, okay, is a very thin part of the retina. After the ora serrata, fovea is the thinnest part of retina. So if you can see in this part, which is the thinnest part, this is fovea, and here there is no layers of the retina except the cones. So at the fovea there is only cones. Okay, so remember, this is a cone, okay, a cone shape, and this is a rod. So rods are basically for R goes with Rath. So basically they are there for the night vision, more in number as compared to cones. So they are 120 million as compared to 6.25 million cones. The pigment in the rods is rhodopsin, where the pigment in the cones is iodopsin. They are absent at foveolar region. They are maximally present at the fovea. Okay. So remember, another important topic that was asked in the AIMS exam, can be asked in the Jipmer, is interphotoreceptor matrix. So the neurosensory retina, okay, have the layer which touches the retinal pigment epithelium. They are the photoreceptors, the rods and cones. So this space between the rods and cones, it is filled with a matrix which is called interphotoreceptor matrix. Okay, so it basically gives attachment to the neurosensory retina with retinal pigment epithelium. Why this layer is important? Because this layer is having the macrophages, very important for the signal trafficking, and it has proteoglycans and hyaluronic acid receptor, that is CD44. Okay, So this was a previous year question. CD44 is present in interphotoreceptor matrix. Okay. So my last question for the day is most radio resistant layer of the retina: endothelium, rods and cones, nerve fiber layer, and ganglion cell layer. So try to answer. So very good, Dr. Surendra. It is the ganglion cell layer. Remember, the most radio sensitive part of the eye. Can you tell, Dr. Surendra? I am asking most radio sensitive part of the eye. This is the lens. Okay, but if they ask most radio sensitive part of the retina, so the question was most, Surendra, most radio sensitive part of the eye. So most radio sensitive part of the eye is lens. If they ask most radio sensitive part of the retina, it is the endothelium of the capillaries. But they are not present in one specific layer. They are present between the outer plexiform and inner nuclear. So the answer, if the endothelium is not given, then the answer is photoreceptors, that is the rods and cones. Okay, so most radio sensitive part of retina is endothelium. If not given in the option, then go for rods and cones. And most radio resistant part of eye, can you tell me? I am not asking the most radio resistant part of retina, but I am asking the most radio resistant part of the eye. Okay, so can you tell me? So the answer here is sclera. Okay, so this is the most important points in the corneal histology and the retinal histology. Any doubts you can put in the comment section. I would welcome you to our next special class, that is on neuro-ophthalmology. We would be taking it in this week. Hope maximum number of students there. Let's crack it.